Hi everyone, welcome to Dentospedia, your trusted guide for dental exams in Canada. Today's video is a complete roadmap to help you crack the AFK exam in your very first attempt. We'll cover the exam format, syllabus breakdown, top study resources, and a step-by-step preparation strategy that actually works. If you're serious about passing AFK, this video is for you. What is the AFK exam? The AFK, or Assessment of Fundamental Knowledge, is the first step in the NDEB equivalency process for internationally trained dentists who want to practice in Canada. It is a computer-based exam that tests your knowledge in both basic and clinical dental sciences, very similar to NBDE, but adapted for Canadian standards. Once you pass the AFK, you can proceed to the next stages like ACJ, ACS, and eventually the NDECC licensing exams. Let's get the structure straight. The AFK is held twice a year by the National Dental Examining Board of Canada, NDEB. It consists of 200 multiple-choice questions, split into two parts of 100 questions each. Each part is 2 hours long, with a break in between. Total exam duration, 4 hours. The questions are single best answer format, with no negative marking. Both papers are equal in format, cover the full syllabus, and are graded together. Now let's take a deep dive into this color-coded AFK syllabus breakdown that beautifully summarizes all 23 subjects tested in the AFK exam, along with their approximate weight and expected number of questions out of 200. Starting from the top. Operative dentistry leads the chart with 15% weightage, contributing about 30 questions. This is one of the most important subjects in the AFK, and it demands strong command over cavity preparation, restorations, and materials. Next we have endodontics, prosthodontics, periodontology, and oral surgery, each of them ranging between 7% to 8%, contributing around 14 to 16 questions each. These are high-yield clinical subjects that test practical decision-making. Pediatric dentistry sits at 5%, with about 10 questions, often testing child psychology, pulp therapy, and fluoride use. Then we move into the foundational sciences. Subjects like dental anatomy, oral pathology, and oral medicine each contribute about 5 to 7%, with 10 to 20 questions depending on the year. Basic science is heavily represented too. Microbiology and immunology and general pharmacology each have 10% weight, or roughly 20 questions. That's a big portion of your paper, and many students overlook it. General physiology, biochemistry, pathology, and dental materials together form a significant segment, adding depth to your clinical reasoning and understanding. Rounding it out, public health dentistry and ethics and jurisprudence may seem minor at 2 to 3%, but even 3 to 4 questions can make a big difference between passing and failing, especially when the cutoff is close. So what does this mean for you? Prioritize operative dentistry, pharmacology, microbiology, and prosthodontics, but don't skip the smaller subjects. Every question counts, especially in a competitive exam like AFK. Use this breakdown to strategize your daily schedule, set revision goals, and allocate time based on weightage. Now let's talk about the best books and materials you should use. Let me introduce you to the Dentospedia Complete Book Set, 23 expertly crafted booklets designed to give you everything you need to master the syllabus and crack the exam with confidence. Each booklet covers a core AFK subject in depth, from operative dentistry to pharmacology, oral pathology to ethics. Important points are highlighted. Smart mnemonics are included to help you retain faster, and cheat sheets make revision a breeze. At the end of every chapter, you'll find high-yield MCQs based on most frequently asked topics, latest trends and clue data, backed by clear, clinical explanations. Low-ha. Plus, every subject includes practice worksheets to help you reinforce your understanding and stay exam-ready. Whether you're studying solo or with a group, these booklets are your complete toolkit, precise, powerful, and designed for results. Dentospedia's 23 book set is not just another material, it's the smartest way to prepare. Because success doesn't come from studying hard, it comes from studying smart. And this is how smart dentists prepare. Other books that can boost preparation. Mosby's Review for NBDE Part 2, concise, clinically oriented. First Aid for NBDE Part 1 and 2, excellent summaries. Wheeler's Dental Anatomy, foundational. Carranza's Clinical Periodontology, Pathways of the Pulp, for endodontics. Levinson's Microbiology and Immunology. Lippincott's Pharmacology. Schaefer's Oral Pathology. NDEB, Released Practice Questions. Here's a time-tested strategy followed by hundreds of successful candidates. Preparation timeline. Ideal duration, 4 to 6 months. Start with basic sciences. Move to clinical subjects, end with revision and mocks. Best AFK mocks are available on our app Dentospedia. Dentospedia mock exams are not just practice papers. They're a replica of the real AFK exam experience. Designed by top dental experts, these mocks follow the exact AFK pattern, time-bound structure, and include a smart subject-wise breakdown to mirror the real test environment. Each mock is packed with high-quality questions, covering all essential and frequently asked topics, with crystal-clear explanations provided at the end to strengthen your understanding. Plus, you get your global rank, so you can track your performance, compete internationally, and know exactly where you stand. Practice smart, boost your confidence, and walk into the exam knowing you've already been there. Daily plan. Study 6 to 8 hours with breaks. 1 clinical plus 1 basic subject per day. Revise weekly. Practice 50 to 100 MCQs daily. Last 4 weeks. Solve mock exams under timed conditions. Revise your flashcards and quick notes. Focus on weak areas, don't avoid them. Join a peer group or study buddy for discussion. Cracking the AFK on the first try isn't magic. It's about consistent effort, smart resources, and the right guidance. If you're watching this, you're already serious about your career in Canada. So stay disciplined, stay positive, and trust the process. Dentospedia will be with you every step of the way. Like, share, and subscribe to our channel for more in-depth videos on each AFK subject, free resources, and interviews with successful candidates. Drop your questions or topic requests in the comments below.